Diabetic nephropathy. Diabetic nephropathy. Kidney damage from diabetes. It is a common complication of type 1 and type 2 diabetes. Over time, poorly controlled diabetes can cause damage to glomeruli in the kidneys caused by high blood pressure. Diabetes can cause hyperglycemia leading to renal damage and ultimately, leading to end-stage renal disease, ESRD, a medical condition in which kidneys cease functioning on a permanent basis, that necessitates a regular course of long-term dialysis or a kidney transplant to maintain life. Hyperglycemia leads to direct renal damage by decreased elasticity of blood vessels, causing them to narrow and impeding blood flow. This can lead to a reduced supply of blood and oxygen, increasing the risk of hypertension, and damage to large and small blood vessels. Vascular damage leads to hemodynamic alterations, i.e. glomerular hyperfiltration, shear stress, and microalbuminuria. Induces to decreased expression of matrix metalloproteinases, MMPs, and increases expression of tissue inhibitor of metalloproteinases, TIMPs. MMP is responsible for matrix degradation. Therefore, decreased MMPs lead to increased matrix increases in the expression of transforming growth factor beta, TGF-beta, genes, and activates the TGF-beta via activation of glucose transporters, GLUT, angiotensin E, and platelet-derived growth factor, PDGF. GLUT1 induces an increased intracellular glucose transport and D-glucose uptake. TGF-beta1 decreases MMP expression, that may lead to augmentation of extracellular matrix protein deposition, collagen types I, IV, V, and V. Fibronectin, and laminin, at the glomerular level through activation of connective tissue growth factor, CDGF, and vascular endothelial growth factor, VEGF, thus inducing mesangial expansion and glomerular basement membrane, GBM, thickening, and glomerulosclerosis. Abnormally activates, upregulates, protein kinase C, PKC, and increases advanced glycation end products, AGEs, and oxidative stress or production of reactive oxygen species, ROS, by activation of diacylglycerol DAG, formation, PKC, and reduced nicotinamide adenine dinucleotide phosphate, NADPH, oxidase. Treatment. Change lifestyle. Diet. Reduce potassium intake, so the intake of fruits and vegetables are recommended. Reduce phosphorus. Reduce protein, so lean meats, e.g. poultry, fish, eggs, unsalted seafood are recommended. Take dried beans or no sodium canned beans because they are low on the glycemic index and can help manage blood sugar levels better than many other starchy foods. Take nuts for healthy fats to prevent complicated heart diseases to regulate blood sugar levels. Exercise. Regular aerobic exercise such as walking, cycling, jogging, swimming, tai chi, and yoga is good. For type 1 diabetes, it increases cardiorespiratory fitness, decreases insulin resistance, and improves lipid levels and endothelial function. For type 2 diabetes, it reduces glycated hemoglobin, HbA1c, triglycerides, blood pressure, and insulin resistance. Treatment. Control hypertension. Angiotensin converting enzyme, ACE, inhibitors, angiotensin II receptor blockers, ARBs. Treatment. Control blood sugar. Metformin improves insulin sensitivity and lowers glucose production in the liver. Glucagon-like peptide 1, GLP-1, receptor agonists, lowers blood sugar levels by slowing digestion and stimulating insulin secretion in response to rising glucose levels. Sodium glucose cotransporter -2, SGLT2, inhibitors limit the return of glucose to the bloodstream, leading to increased glucose excretion in the urine. Treatment: control high cholesterol and reduce protein in the urine. Statins lower cholesterol. Treatment: for tissue scarring, finerenone disrupts molecular activity causing inflammation and tissue scarring and reduces the risk of kidney function decline, kidney failure, cardiovascular death, and non-fatal heart attacks. Treatment options for ESRD: kidney dialysis, transplant, kidney transplant, kidney pancreas transplant. Pancreas transplant restores endogenous insulin secretion and control glucose level. Palliative care